Oh, thank you very much.
Check her.
DJ yang itu permanent. Berarti dia kau dua rahasia. Permanent dan pensionable. Dia aku muda.
Carinzo, 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 carinzo.
As Dr. Catherine said, will be the center of excellence, so many innovations will be happening in this clinic. And I hope that the partnership will be strong for us to achieve this objective. So at this point, I would like to reiterate the fact that drug addiction is a disease and requires a multi-stakeholder approach. This program requires that all our stakeholders, including the CSO, the community, the religious leader, the law enforcement officer, the media, the healthcare workers, and family work together for the success of this program. What we observe is that for people who unfortunately are arrested by the law enforcement officer, they can't access to the daily methadone dose. So our appeal is to the prison and the administration to facilitate, to help them to access to the methadone and other services. Political leader, we ask you to support the integration of livelihoods support to enable the PWD earn money to sustain themselves and to reintegrate into the society. That's the aim of this harm reduction program, where Mart Clinic is part of the harm reduction program.
It is worth to note that all facilities are within government health facilities in over 6 counties, and through this kind of collaboration, 7 more clinics are ready for launch, including one at Shimolatewa prison and a mobile dispensing van. More than 6,000 drug users have been put on medically assisted therapy nationally, and it is projected that over the next 5 years, we should be able to reach the 23,000 drug users that we have in the country. This launch comes at an opportune time when we are witnessing a revolution in practice, a revolution which brings together national and county governments, policymakers, people who use drugs and those that are recovering, human rights advocates, public health practitioners, financial and technical resources that make a difference and provide evidence-informed solutions in drug abuse management and control, including harm reduction. Drug use has become a major factor of HIV transmission in Kenya. The prevalence of HIV among people who use drugs is 18.7% as compared to that of the general population, which is 4.9%. Kiambu, as a county, is among the top counties of people who use drugs or heroin, after Mombasa, Nairobi, and Kilifi counties. Surveys conducted by the Ministry of Health estimate that Kiambu has approximately 1,300 people who use drugs. Nationally, 92% of those using drugs are heroin addicts, and 8% are addicted to other opiates. Women form 8% of all the injecting drug users. there are strong indications that the numbers of drug users are underestimated, particularly among women and children. I think this is expected given the fact that drug abuse is stigmatized and not recognized as a medical condition, which it truly is. The numbers that we see may not reflect the true situation, and that we need to be able to identify all those who are affected, and we need to give them the help they need in overcoming this problem. This increased risk of HIV infection among people who inject drugs is attributed to mostly high-risk injecting practices and also risky sexual behavior among this population. Further studies indicate elsewhere suggest 2 to 3% of people with opiate dependence die each year, while the mortality rate for heroin users, the 92% that inject drugs, is 6 to 20 times higher than the general population of the same age and gender. These programs additionally go a long way to improve the quality of lives of the beneficiaries and reintegrate them back into their families, the community, and society. To respond to this challenge, governments and their partners, with leadership of the Ministry of Health, like in this case of Kiambu, have spearheaded harm reduction interventions as part of the larger universal health coverage agenda. The World Health Organization recommends the following 9 interventions: medication-assisted therapy or MAT, needle and syringe program, HIV testing and counseling, antiretroviral therapy, prevention and treatment of sexually transmitted infections, condom programs for people who inject drugs and their sexual partners, targeted information, education, and communication for people who inject drugs and their sexual partners, diagnosis and treatment of and vaccination for viral hepatitis, and prevention and diagnosis and treatment of tuberculosis.
I'm very happy to see that it has started to get patients. Na nafurahi sana kwa sababu nimeona wale ambao wameanza kutibiwa. And as we have been going around, being shown around, we have seen even those ones who have been treated, and they are being treated, but they are now working here and are reaching out to other people. As Dr. Rashid has said, the best person to bring in somebody who is affected is somebody who has been treated and recovered and now can be an example to others. So we want to thank you most sincerely. We want to thank MSF, not only for the investment. This investment has taken up less than 500 million shillings to bring it up to where it is. Not just the hard drugs, heroin, as we've been saying, but we need to consider the bigger problem in Kiambu that has to do with alcoholism and taking of other drugs, because this treatment is basically for heroin, which, as we are told, a large proportion of the 1,300 people in Kiambu who are taking heroin. But we do have problems with other kinds of drugs. We do have problems with alcoholism or taking illicit brew. And therefore, we need a much more holistic approach. This is an example of what you can do when you are focused. What the beneficiaries have been saying and what a number of readers here have said. And I want to say this, first and foremost, as a county, we are going to work with this clinic. We want to support them to make sure that they succeed. We've already discussed in linkages with our hospitals, because sometimes the patients will require to be referred to our other facilities, level 4 and level 5 facilities. So we will prioritize that when those patients are taken to those hospitals, they are given the care that is required. We are going to put together a team that will explore ways of providing opportunities for the people or for the patients who have recovered. Because our problem was when they were taking drugs. Our problem also should be to make sure that they do not go back to taking drugs because they have become idle. There are various ways through which we are going to look at this. Yes, we will look at the possibilities of offering you job opportunities in the county, but that is not enough, because we cannot give everybody a job. If anything, we are looking at the possibilities of reducing the number of jobs that there are in the county. So we can not give everybody, but we'll be able to give you opportunities to work with us in the county as we improve the socio-economic circumstances of the county. But secondly, we'll be looking at the opportunities to economically empower.
Kwa saa hii hata mkaniona hivyo venye nimetoa jasho, nimeapprove. Nimetoka dancing saa hii niko bie naweza fanya kazi. Nilikuwa nashinda koden. Nilikuwa nashinda nikivuta dawa, heroin, mimi nilikuwa mtu wa kujiboga. Hivyo naweza ambia mayouth wenye watu wako huko, msikuwa tichinati sababu hakuna wasi wa kutuchukua. Mnaweza kaamuku, mati ni free. Mkam tusome kiradhi man, tukunywe kimati. Mambo yao mnaambiwa timati si mzuri tinaangusha watu. Bado sika mimi mwenyewe it's for your own good. Ukikam utapata hadi wife, upate watoi, watu wenye walikuwa na korofishana hapa na inaitwa methadone. Tunakam na inakusaidia. Inatuizo maurosto, una reform. Kwanza hadi sasa mimi singeweza kusimama hivi mbele ya kamera nianze kubonga. Nilikuwa shy, nilikuwa obvious kila time nashinda nikichoma na lala chini ya mavibanda. Sasa hii hadi naweza kulenti nyumba. Naweza kufanya job yangu juu niko na wife. Kila wife wamerudi. Sasa hii hadi watu wao unaweza bado. Wasijaribu. Mtu anaanzaga tu na kuonja. Ukionja tu unasikia kweli iko sawa, lakini usiwe ionje hiyo kitu. Juu ukionja life yako imeweka kwa kaburi. Sahau. Biki tunaweza ambia mtu sikiza tu wazazi, fuata church.
Maisha yangu tangu nianze mat imekuwa mzuri sana, hadi sikuwa na wife alikuwa amepotea juu sikuwa namwangalia. Dua zote natumia huko kwa madawa. Sasa hii hata asharudi. Hii mat imenisaidia mbaya sana. Sasa hii hata ile uchafu yenye nilikuwa nayo sasa hii niko sawa. Hadi anaona yani na change. Hadi bibi yangu sawa shaona ukijana ameanza kuchange unaona.
Hii kwa venye nimetumia methadone, tuseme life imekuwa poa. Hadi society sasa imenikubali kwa venye hiyo time yenye nilikuwa natumia madre yani madawa za kulevya, hiyo time hadi society iko inataka kuniona, lakini saa hii tuko sawa. Methadone imetusaidia, hata LVCT yote imetusaidia sana. Mimi nilikuwa nimetumia hii madawa for 7 good years, lakini saa hii nimeabstain sana, nataka hivyo bila kutumia madawa. Ningetaka kuambia kaa gavana wetu Nyoro tunamheshimu sana, amefanya kazi mingi mzuri, lakini si atuangalie vijana hawa wadogo. Tunaweza jihasoria, lakini hatuna hizo opportunities za kuweza ati kujisimamisha. Kama mimi ni designer, ningetaka hata mimi niwe nimekaa mahali nafanya kazi yangu na nilishe familia yangu yote.
Kwani tunavurugana, kunyanyasana, kuzozana na hata kupigana.
Leta pesa yangu bana, sitaki ujinga. Mwambie nipatie ndo yangu.
Ndio ndugu kwetu. Kudhulumiwa na kudharauliwa ni mtindo. Maeneo wanadau, chifu na polisi hutuvuruga na kutukamata.
Oya, jaribu kutoroka, msiende mahali. Toa,
Wengine
Mombasa nikaenda, nikarudi Nairobi, nilikuwa street girl. Ndio nishikwe nikiwa Nairobi, nilishikwa 015 mwezi wa 8. Venye nilishikwa, nilikaa prison, niliserve kifungo 2 years. Nikiwa nimebakisha 1 month, ndio AMLES iliweza kuniachilia kutoka kwa president. Ningekuomba James, nilikuwa addicted mbaya sana. Hata watu wengi huku wananijua na wananifahamu. Kwa saa hii nilianza mat, nashukuru Mwenyezi Mungu, nimeanza kurekebika. Na kama pia mimi venye nilikuwa nikiziuza, ningeweza kukuomba, sina kazi huwa nafanya. Na sisi wenye tunavutanga madawa, venye niliacha, ukiona hauna kazi ndio unaweza kuenda kuirudia. Ningekuomba uweze kututafutia kazi.
Recovered Addicts. Niliingia kwa hii seminar ya LVCT in 2018. Nikangangana mpaka nikamaliza last year mwezi wa December. Saizi I'm a free man, sina kitu inanisumbua. I can do my businesses, I can support my family. Saizi I'm a normal person like anyone else. Asante sana LVCT, asante sana Methadone kwa kutusupport. Wapesti wangu wetu, watu mtu anatomboa. Si ati ukiingia Methadone utashida huko mwaka yote. Kingangana utakuja uache na uwe mtu kama raia mwingine.